Step by step, we'll light the way.
All righty, wonderful. Good to see you, Doctor. And the today we were going to talk about methylene blue, which I find extremely interesting and has so many applications.
So methylene blue is something that I guess I used to play around with. Must be over 10 years ago now.
Okay.
And how I was using it was with this treatment called photodynamic therapy.
Yes, I was going to ask you about that.
Yeah, because what methylene blue represents is like there's a bunch of medicines or medications, natural agents that are photosensitive, like they react to wavelengths of light. And so methylene blue is one of those that I was actually using to blast or pulverize like certain tumors or certain skin lesions and things like that. So I have a really interesting case report of a patient where she had a melanoma in the ear that was missed even by dermatology, and then when they discovered it, they wanted to cut off her ear and
Mm.
resect part of her neck. Anyways, so we did that plus a bunch of other things, and it's been like what, 4 or 5 years, and everything is great, and the ear looks perfect. So methylene blue has that angle, like being used in photodynamics. So that's how I first learned about it. And then move forward to the future, there was this whole other uses like in cancer. And then what's interesting is that and that's like using it orally, for example, and people are using it many ways. But what's funny is that I guess when I was using methylene blue, I was just interested in a bunch of research and its use. And you know what I found? I found a paper from 1909.
Really? I didn't know it's been around that long.
Yeah, and it was published in JAMA, Journal of
No
the
kidding.
Journal of the American Medical Association, and it was regarding an MD back then, right,
Hmm.
on his experiences in using methylene blue in cancer.
Wow.
Yeah. And so when all this popularity began, I was like, it's like I remember reading something. So this paper that I kind of had buried, popped up again. And so I looked at it and I was just like, gosh, like this was conventional medicine
Right.
over 100 years ago, and
Wow.
back then, obviously, there was no double-blind randomized trial
Right.
stuff. There was, questions of hygiene. There was no like fancy imaging and blood work and things like that. It was a bit more raw.
Right.
But, these doctors were talking about, like, this doctor was talking about his, like, I think 15 years experience of use,
Wow.
and talked about his community that he felt there were patients that helped them with cancer. So here we are, 2026, right?
Right. I had no idea it had been around that long.
I know. To be honest, it slipped for me too. And where, people are using it for all these reasons, it was probably thrusted a lot when Mel Gibson went on Joe Rogan's show and he talked
Right.
about it, and that made it explode to, I guess, another level. But so, anyways, when you look at its use, it's like, yeah, it has this, I guess, there's a conventional uses of it, right? Like it's used conventionally for like mapping lymph nodes with surgery.
Okay.
There's some papers using it for like a certain type of hemoglobin issue that's used like in that area. There's been some papers using it for like septic shock, and
Okay.
infections and cancer. This is like conventional applications, right?
Right. Right.
So it's this really interesting kind of dye that that really that wears many hats.
It I was doing some reading. It can help out with even chemo side effects. Is that correct or incorrect?
Yeah, no, like there's even there's been some papers published using it for like sores in the mouth, like
Hmm.
mucositis it's called, right? And so it helps to like calm that down. There's been even been comparisons to like magic mouthwashes and it worked the same. And yeah, sure, probably stained your lips and teeth for a bit.
Right, right. Yeah, it looks like you swallowed a Smurf or something, but the and it's just used as a mouth, and they're just using it as a mouthwash or rinse.
Yeah, like my daughter, for example, like when she gets those sores in the mouth,
Yeah, like a
sometimes,
canker
right?
sore or something.
Canker sores, yeah. That I remember like an old timer were telling me that's what they would use, when you get a Q-tip and you stick it on there
Yeah.
and that's what I use with her and it calms it down, So it's got these like diverse properties, this anti-inflammatory, this regenerative, repair, like obviously there's this talk with it having antidepressant properties, right? Like
Wow.
yeah, like who doesn't need that? You know what I mean? And
I just stopped turning on the news.
yeah, that's probably the best answer, right? But so yeah, and that's why they say, oh, you got to watch taking certain antidepressant medications, right?
Hmm.
And that's why people talk about it helping with like the nervous system and repair, right? Like it's really it's as I said, it wears many hats, and so it's one of the ones that like the I guess the oral use, the IV use, people are breathing it in, they're doing all kinds of things with it that I'm always curious about, right? So as a consequence, there's this, I would say, newer wave of interest in applying it for cancer and all the complications that come with cancer.
Right, yeah, because there can be quite a few.
Yeah.
And the uh is has there been some research done I know in it helping with cancer cell death, apoptosis? Is that correct as well or no?
Yeah, there obviously have been like, these some research suggesting that it could help to fight cancer and cancer cells, right? And I remember even seeing some work out of like Russia or Eastern Europe and so like anything, I think it's direct use as an anti-cancer agent obviously is still considered experimental or
Okay.
preliminary, right? And a lot of and preclinical. However, it's definitely one that it's like, look, here I told you about used in conventional medicine 100 years ago, right? So
Right.
it's I think there's modern uses, right? And I guess looking at the modern use in fighting cancer, I guess that continues, right? But obviously people have their experiences and their stories with it, and that it's doing many things. So it's obviously like, yeah, we because in our practice, like I know people are always looking for magic bullets. I get
Right.
that, and but more I'd say we practice is magic machine guns, right?
Right. I think that's a really good terminology.
Yeah, and so yeah, we have patients who are throwing it in the mix. We've using it IV, and they're doing well, and you're just like, okay, is it one of the things helping? Could be,
Correct.
and
Another tool in the toolbox. Is it is it also helping with inflammation and about if it is how much are patients have would you is a suggested dosage, and if it's is this done orally or by an IV?
sure. I think you can, I think you can use it in many ways. So we do. We use it IV and also orally, right?
Okay.
Sometimes what we tend to prescribe more, you can get them in these pills that's less messy, like so.
Right.
So what's common is like a liquid. I think I'd say it's more readily available, the liquid, it can stain you a bit, right? But
I'll also
so
tell you it's a little rough on the palate.
yeah, see, yeah, it's
Yeah.
that, and that's what I mean. So there's some places are dispensing these like more pill versions that are easier to take, and so. And I know when you're talking about like dose with it, like some people are talking about, well, you need so many milligrams per kilogram of body weight. My experience has been is because when you're looking at the old use over 100 years ago, they were using a good dose of it. Like they were using, hundreds of milligrams, even probably up to 1,000 apparently, but whenever I like, and I was at one point prescribing like say about 25 milligrams just to start with, but you know what happens to some people? They felt a little bit spacey with it,
Hmm.
and I think that's that central nervous system, targeting the brain, the nervous system kind of
Right.
effect. So because of that, I started more prescribing like 5 and 10 milligrams to start with, and then just seeing how they tolerate it, and see how they feel with it. Like, and if everything seems okay, you could up it to like 20 milligrams a day, 30 milligrams a day, and then just go from there. So I'm not sure exactly what the magic sweet spot is, right? Like I think everyone's got an opinion on that. But so I guess as long as people are not having any kind of weird side effect like that,
Right.
then I think you're good to go, right?
I I had taken it a while back ago as a recommendation and for help, and I had a little bit of a I would call it that spacey headed, you know, feel, but but I've been knocked in the head before, so I didn't, I'm like I don't know if this is just a residual. This is just a residual from, from doing some sparring in the ring or not, but the and I'm going, oh boy, it's the liquid. Nice to know that there's a pill form because the liquid is it's a little rough on the palate. So we need to swig that down a little bit quicker.
Yeah, no, no, for sure, for sure. But it's like, but imagine like say a medicine that, as I said, wears many hats, right? Like it
Right.
can help with like some mood. Who doesn't need that, especially with
Hmm.
cancer diagnosis?
Right.
It can help with like infectious shock, like so there was been papers with infections in people with cancer, and it helped to
Hmm.
help with minimize reducing the shock, and obviously with we talked about the mouse sores and chemo and whatever
Right.
other sores, like it's quite interesting, when you really, think about it. And then obviously its applications with light, to have like, so it's interesting in that paper over 100 years ago. I remember reading, what the doctor said. It's like they said that, yeah, we noticed that when patients were in the sun with it, they seemed to do better.
Really?
Yeah.
So the
So
like the red light beds I that are used in clinics often, like the red light beds.
yeah, so imagine like obviously 100 years ago they didn't have stuff like that. They
Right.
were just talking about sunlight, right?
Yeah, they
But
said push outside.
yeah, but it was interesting, and they didn't understand photodynamic or photoactive, right?
Hmm.
But yet, here was just these clinical observations that, when you go into the light with it, it seemed to like they do better. So, and as we
Right.
know, light activates it more, right? And so,
Amazing.
yeah, so should we be like dosing this stuff? And I know with Arizona you are, you probably get
We have
lots
no problem with sunlight. I mean, that's our flag, right? I was out today, and it's in the low 100, so it's nice
Oh,
and nice and toasty.
nice, nice. Yeah, so imagine like you have this medicine that could like, maybe it's like should that be used that way, right? And then the light beds that you're talking about, so like a comprehensive
Hmm.
program of some kind, and then obviously like, could it be helping to fight like infections and things too with the light, right? Like there's, when things are floating in the blood, how about cancer cells that are floating in your blood, right? Like
Right.
the cancer stem cells that everyone's talking about, right? And
Right.
and they're the circulating tumor cells, right? And so it really, it really kind of has that diverse hat. So, we kind of can use, like, we have these IV lasers that you can put into the blood.
Hmm.
And so when people are getting it, we tend to like tap that with it and as well, just to try to address some of the circulating potential cancer stem cells and the rest. But I guess if you were popping in, these say oral treatments and you get some sun exposure and
Right.
getting out there, and it could be having this additional supercharge effect, as well. So it's an interesting one, right? That it's basically that dye is making like a a full circle.
So I assume that with an IV form, then the dosages are higher than what you would get through a pill form.
Yeah, like I think like anything, you could obviously it's 100% absorbed, and so yeah, you could do more in the pill form, but like anything, you just want to make sure that everyone's okay. They say like the vitamin C, like, you should be looking at something called G6PD, like
Hmm.
that just to make sure that there's no rare risk of, blood being impacted. But yeah, it could be used that way. So that's why you're seeing now a lot of centers exploring its use. You're finding obviously people like when they're taking it, it's like, God, like my mental clarity seems
Right.
better, and so.
I can tell you from experience that clarity seemed to be better.
So yeah, it's one of those ones, right? And so, and I personally never would have like thought about its use as a direct anti-cancer body agent before. But like I just in my earlier days, I just thought it as use it with light,
Right.
and so as a more targeted local effect. But now it's just seems like, yeah, that's why you're seeing clinics like their facilities. Yeah, they're getting people on it. They're getting those big light beds. They're just
Right.
getting whole or more targeted, like areas like regions of your body and or using laser. Like it's just kind of endless. Or maybe going for outside sun exposure. You know what I
Right.
mean?
And well, the light beds are usually the red light beds are usually what about 15, 20 minutes, something like that.
Yeah, like yeah, that's what you would assume to do. Like the photoactive nature works quick, right?
Okay.
Like if you say like if I put say red light on my finger, right, and just shine a red light of a certain power, it's like, yeah, I can maybe feel it a bit, right? If I dip my finger in methylene blue and it was blue, right, and I put that light in the same spot, it will start to get like, oh, I gotta pull it back.
Really?
Yeah,
Wow.
yeah.
And how often can someone you think take methylene? Could they take methylene blue by IV?
Well, again, so depending on your goals and everything else, right? But these are things you could, in theory, do it every day, right? And
Right.
you really want to load yourself. But we tend to kind of incorporate them in like maybe once a week, twice a
Okay.
week kind of thing.
Okay.
And then we try to be creative with like some light as well, and so it's and using some of those technologies as well, and so.
IV, then your tongue wouldn't be blue.
That's right. No,
Right.
the only thing that's turning blue is on the inside out.
You look like you've been eating a purple popsicle or something, yeah, as a kid. The
Yeah.
and yeah,
And then,
I just found that just amazing that it was originally like a fabric dye, is that right?
yeah, that's correct. Yeah, it's I don't know exactly how it crossed over in medicine, like even from over 100 years ago, but
Yeah. Like how
but
did that happen?
yeah, like for some reason it crossed over. It was probably some story, and then yeah, some rare case, and then everyone started talking and started using it, right?
Right.
Yeah, and obviously you're finding like groups of the holistic integrative community, interested in it. Like I remember a good friend went to a conference and then he goes into the washroom urinals and they're all blue.
Right. I was going to warn everybody about that. Just to let you know, there's no need to run to the emergency room. Yeah.
Yeah, blue or green, right, coming out of you.
Right, right. Yeah, this is not, yeah, this is odd.
Yeah, but it's interesting. I had one patient tell me that, they were dosing it, and they go, Walter, I my urine or my stool is not changing color, and
Okay.
it was if like the body was like sucking it like
Mhm.
crazy. And then I think after a while, like of using it, I think it took like several weeks. Then that's when there was that change in color in the urine and so it was like the body was using it,
Okay.
and utilizing it, right, and or make it into like a non-colored form, right? And that's what you'll see in some of the research papers is that when there is like oxidative excesses, like the methylene blue is involved in that, and then actually the solution can turn colorless. And
Okay.
so, yeah, so probably for some people, like when there's a lot of oxidative excesses, it's like it's using it, and then when the body's a bit more saturated or filled, it you can see it.
That's just really interesting. It has all of those positive side effects over something that's been around for 100 years and can even be used to mitigate symptoms from chemotherapy.
Yeah, yeah.
And I was reading that it's not like oncologists haven't recommended it, right? That they were recommending it.
Yeah,
You know, sort of.
it's interesting. Even though there's growing amounts of these research papers, you're actually, yeah, you never ever hear about it being recommended.
Hmm.
And so it's just one of those things, even though it's published in mainstream, journals, and it's just one of those things, that it's just it hasn't gone there. And
Hmm.
so it's, for whatever the reasons are. And
And you can get, I mean, this is a relatively available product.
yes, yeah, it's very readily available. And it seems like, patients are coming in already have it on stock. And
Right. You know, the
so
yeah, Amazon will deliver it right to your front door, not by IV, but you could, yeah, right to your front door. So the that's but you could, of course, I would encourage everyone to be, working with their naturopath or doctor regarding these things, and maybe you might see benefit from, higher dosages by IV, especially if you got, issues like, like cancer. But yeah, the only thing I had a little bit of a foggy headed a little bit. Maybe I was a little foggy headed, I guess, maybe dizzy, and then that went away.
yeah,
Spacey feeling, I guess. But and the blue tongue, right, and then the urine. But cognitive abilities picked up. But just to know that it can help solve so many of these symptoms and be so helpful over a product that's been around for over 100 years.
yeah, that's right. And as I said, I think the only groups just some of the groups just to be more cognizant of or careful is because they talk about it having this antidepressant properties, and we know a lot of people are on medications out there, and so
Right.
just like anything, I think you just gotta, that's where, as you said, seeing groups
Need to be
facility.
seeing your doctor about those issues, and before you start mixing things and end up, with some unusual or harmful side effects. So get your doctors involved, of course, especially when you're dealing with those types of issues. Well, this has been extremely informative, and I hope people viewing this realize that, hey, there's other options out there to help you with the symptoms that you may be having with your cancer and your chemotherapy, and or getting your naturopath involved with the red light therapy and the methylene blue, And it's just one of those other tools in the overall toolbox, that machine gun effect that you're talking about, which is a great analogy to being able to solve a problem. So it's not just one or two tools that are being used, but multiple to solve the problem.
Yeah.
Get your health back.
That's right.
And
That's right.
there's plenty of hope and patients out there that are getting their lives and health back, and this is just one of those other tools to be able to help out with that. Well, Doctor, I really appreciate your time and going over this, and I hope everyone else is receiving benefit as I know, and knowledge that I am, and help move things forward in their health.
Thank you very much. And thank you for creating the awareness and the attention out there.
Oh, my pleasure. Happy to help, Doctor. I look forward to speaking with you next week.
Okay. All the best.
Yes, sir. Bye-bye. I hope you enjoyed the video. If you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at findhelpforcancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.